Medicare certified home health agencies are required to obtain a face-to-face encounter for, for them to start a home health services for a client. What is a face-to-face encounter? Face-to-face encounter is the document that indicates that a patient has seen their primary care doctor or other person who's taking care of them, indicates that they need services for home health. Without face-to-face encounter, you will not be able to get paid for the services that you're about to start. So let's say you start a home health services and you have been doing for the last 6 months. But if that face-to-face did not happen, that claim, all of that claim, is going to have to be refunded. So face-to-face requirement is critical step for you to start a home health services. So a face-to-face can take place 2 times. It needs to take place within the last 90 days of the date of the start of care, or it must take place within the next 30 days after start of care. Let's say you have a client who you think needs services based on their documentation. They need services, but they have not seen their doctor the last 3 months. You can go ahead and start evaluation and do the assessment and care planning and even start the services. But within 30 days of you starting that services, you need to get a face-to-face with that doctor, with this client, in order for you to continue providing the services. It's very critical. You could owe a lot of money for not having that. Okay, so a face-to-face was introduced into law in Obamacare, and it basically made a condition for payment. Okay, the purpose of the face-to-face encounter is to ensure that you don't just manufacture clients and start providing them services without someone else, an independent person, because that physician cannot have any interest in that company, without someone else indicating that this client needs services. So the face-to-face says that the patient met with the primary care doctor, and the primary care doctor has indicated that they need home health services within the last 3 months or within the next month from the date of the start of care. So it's a critical step to prevent fraudsters from providing unnecessary services. A physician is approving the services.